Hi, my name is Lindsay Davey. I'm a physiotherapist that specializes in breast cancer treatment side effects, lymphedema, and cancer recovery. A lot of my breast cancer patients ask, what are the best exercises to do when they're ready to start strengthening after treatment? We're going to demonstrate 5 exercises that I typically like to assign at least 6 weeks after surgery when their surgical restrictions have been lifted and the incisions are healed. We always recommend, if people aren't sure if initiating a strengthening and mobility exercise program is appropriate for them, to speak to their doctor. The exercises we will describe require very little equipment and can be done at home or at the gym. All you need are 2 light hand weights of approximately 2 to 3 pounds each to start, a bench or chair nearby, and a mat or a carpeted area for your comfort. Let's begin. This exercise is called bridging. You simply lie down on a mat or carpeted area with your knees bent, feet planted, and your weights can be nearby for a progression we'll show at the end. This exercise involves squeezing your buttock muscles to raise the hips slowly up and down to challenge both the legs and the core muscle groups. To increase the challenge, you can simply hold the weights pointed straight up to the ceiling while the hips are rising and lowering for an additional challenge. We would repeat the bridging exercise 6 to 10 times for 2 to 3 sets. This exercise is called the bent over row. I suggest having a chair or bench nearby so that when you're in the position, you prevent your knees from moving too far forward. You just want a slight bend in the knees. You'll need your 2 small hand weights, which you can pick up. To get in position, you're bending forward at the hips, holding your hand weights in your hands, which dangle in front of you. The exercise involves bringing your hands toward your hips as the shoulder blades squeeze. You want to make sure you're keeping your chest in good posture and you're not hiking your shoulders up toward your ears. We'd repeat this exercise 6 to 10 times for 2 to 3 sets. For an additional challenge, once the arms are up in the squeeze position, you can simply straighten your arms out behind you to increase the challenge to the back of the arms. And that is the bent over row. This exercise is called the squat. I do recommend having a chair or bench in front of you so that as you lower your hips in the squat position, it will prevent your knees from moving too far past your toes. We want to keep your knees in line with your shins. For the squat, you simply lower your body, bending at the hips, keeping your chest up and looking straight ahead. Slowly rising and lowering with the arms to counterbalance the hips moving back. To increase the challenge, you can slow down this exercise, taking several seconds to go down and several seconds to rise up again. We would repeat this exercise 6 to 10 times for 2 to 3 sets. To increase the challenge further, you can step away from your chair if you're confident in your knee position, get into a squat position, and then take very small steps to each side while maintaining your back and hip position. And that's the squat. This next exercise is a combination arm and shoulder exercise. You don't need any equipment except your 2 hand weights, which you hold in each hand. The first step is to bend the elbows to 90 degrees and then lift the shoulders out to the side so the hands are facing forward and your arms are flat, parallel to the ground. You then lower the arms and then straighten the elbows. This can be repeated several times, and you can start with this version of the exercise. Another progression would be, once you're up in the elevated position, to rotate the hands so that they're facing the ceiling and then press them up toward the ceiling, dropping them then back down to where they were, rotating, and starting again. We would repeat this exercise 6 to 10 times for 2 to 3 sets. And that is the shoulder and arm exercise combo. Our final exercise is a balance challenge I like to introduce. You don't need any equipment, except I do recommend having a chair or a surface nearby that can be used to touch if you need to stabilize your balance. The goal for this exercise is to achieve 30 or even 60 seconds of standing on one leg. The leg that you're going to stand on is a little tiny bit bent at the knee, so it's not locked in a stiff position. And the goal is to reach 30 or 60 seconds without having to touch down. Again, if you need to reset your balance, we recommend using the hand on the surface to do so, rather than stepping the other leg down. To increase the challenge, while standing on one leg, you can take your small hand weights and proceed to do bicep curls while balancing on one leg. And that's my favorite balance exercise. I hope these exercises are helpful as a guide as you enter your strengthening and reconditioning phase of your recovery. Good luck.